The coronavirus pandemic has changed how we go about our daily lives, leaving us with many questions. One thing we know for sure is that older adults have the highest risk for severe illness resulting from COVID-19. At Country Meadows Retirement Communities, our number one goal is to protect our residents and coworkers. To mitigate potential spread of coronavirus, Country Meadows created a community health support center at its Mechanicsburg campus, offering services to seniors recovering from COVID-19.
It was a very forward-thinking idea that came out of Country Meadows and their leadership, because they had the capacity, the space, and the know-how from an infection control perspective. And through conversations with Hershey Medical Center, they were able to establish this center as a resource to the surrounding counties. So it's a very progressive, forward-thinking movement. Pretty impressive from Country Meadows' standpoint to be able to establish it.
The Community Health Support Center welcomes clients who test positive for COVID-19 and have mild symptoms or are asymptomatic. Not only does the center provide a safe, welcoming space for guests to recover, it also reduces potential spread of the virus to others in the individual's permanent place of residence.
We've been using the center as much as possible to try and decrease infectious spread in the community. We're finding that there is other modalities with which this disease is transmitted, through droplets in the air, and that's very hard to protect the elderly from transmission other than keeping them in their rooms. It's been a significant tool for us to be able to do that.
Country Meadows Community Health Support Center provides personal care services to its guests in a warm, home-like environment. The center offers 21 fully furnished apartments with private bathrooms, cable television, and in-apartment meal service.
You're going to get a warmer type of approach to care than you would in a hospital setting. And it's not your traditional skilled nursing facility or rehab. It's a personal care home. So the facility in general is more attractive. It's got a warmer feel to it. It's more of a home-like environment. And there's a good level of attention from the community staff and the services that are provided.
A dedicated, specially trained personal care staff wearing full personal protective equipment supports center clients only. These coworkers use a separate restroom and break room, as well as a separate entrance to prevent crossover with other campus areas.
Trying to separate the non-infected and the infected can be difficult for the staff at a regular community. So when you have a dedicated staff that's just serving COVID positive patients, the level of fear is down so that the level of attention is up, because they know what they're dealing with, and that those folks get more one-on-one care than they would at their regular place of residence during a suspected outbreak.
Clients may choose to temporarily move into the center for several reasons.
A diagnosis of being COVID positive, but is not necessarily at the level of needing hospital care. If somebody is coming out of the hospital, it is an opportunity for them to go to the center to be cared for at a higher level than they would probably at home, and wait out that infection transmission period in a safe place. There's a mission behind this from a population health perspective to make sure that the person that has COVID is being properly cared for, that they're getting the proper attention that they need, that they may not get in the community or at home. But also, you're protecting other vulnerable individuals from contracting the disease and potentially getting very ill or potentially dying. When you're trying to consider whether or not you should move a loved one into this center from their permanent residence, I understand that any transition can be difficult, but please rest assured that the staff there is caring, and they're doing this in an effort to try and decrease the spread to other people that do not have the disease.